Every body type comes with its unique health advantages and unique health risks. Joining us now is Dr. Rob Kenney, Medical Director of the Bariatric Surgery at Western Missouri Medical Center, and we're talking about body type and really fat distribution.
Yes.
There are a couple different types of shapes. What are the two main ones?
So the two main types of shapes, we talk about an apple, which classically would be men, and that most of their weight would be carried in their abdominal cavity.
You carry it all in your stomach.
All in the stomach. And then the other shape is more of a pear, and classically we think of that as more women, and usually that body fat is distributed more in the lower hips and legs and thighs.
Which body fat distribution puts you at a greater risk for what?
So an apple generally puts you at greater risk for type 2 diabetes, hypertension, hyperlipidemia, heart attacks, coronary artery disease.
So some pretty serious things.
Yes, and that's why we see men have generally a higher risk of heart disease than women.
You specialize in weight loss surgery. That's one of the things you specialize in. We're talking about 3 different kinds, although one of them, while it used to be popular, isn't really done anymore. Which one is that?
That is the adjustable gastric band. And what we found is that the results of that just weren't as good as the other 2 procedures over the long term.
Which one is the most popular, do you think?
Currently in the United States, the sleeve gastrectomy is the most popular.
And how does that one work for people who don't know about this stuff?
Sure. So we do, both of the procedures are done laparoscopically. We make small incisions in the abdomen, put a camera in, put instruments in and do the procedure through there, so they're all minimally invasive. With a sleeve gastrectomy, what we do is remove around 80% of the stomach. So where before you could eat a large meal and the stomach would distend, now there's a narrow tube after a sleeve gastrectomy, so people can't eat quite as much.
Do you emotionally feel full? What do you hear from your patients afterwards?
A lot of patients, let's say, I feel full most of the time, even after eating a very small amount.
Huh, and that works pretty well.
Yes.
And then there's the gastric bypass and the gastric
bypass.
Gastric bypass. So how does that one work?
So with a gastric bypass, what we do is we make a small stomach pouch, and then we bypass most of the stomach and connect the small intestines right to that stomach pouch. So we bypass most of the stomach.
Which one do you feel people like the best? What do you hear? I know you do both, so it's kind of like pick your favorite child, but which one do you hear the best results from?
So we get good results with each procedure.
Yeah.
What we find is with a gastric bypass, if patients have type 2 diabetes, a gastric bypass works a little bit better, but there can be some longer term health issues with that. So for a lot of people, the reason that the sleeve gastrectomy now is the most important, or is the most commonly performed procedure, we just see less longer term health issues with that.
And do people, after they get these, have to go on pretty strict regimens as far as having the right vitamins and nutrients because you're putting less in there? You have to make sure what you're putting in is really quality stuff?
Yeah, so ultimately patients get put on a regular diet once they've advanced through the initial stages. And typically we put patients on a high protein diet because we do want them to get high amounts of protein so they keep their muscle mass up. And they do all have to take a vitamin regimen to make sure they keep their B12, vitamin D, and all the other vitamins levels at good levels.
Do you recommend they lose a certain amount of weight before they consider these? Or is this something where someone who's just not losing any weight can come in and say, look, I'm not going to lose 20 pounds. I need this because I need to really lose 100 pounds.
Well, what we see is by the time most of the patients have come to a surgery office, they have tried multiple other diets and have not had the success they would like. Now that being said, our clinics are multidisciplinary, so they work with a dietitian, they work with an exercise therapist, so we get them kind of holistically. We want to get people on the best, eating the best foods, doing the best exercise, and we find that we get the best results with surgery when we do that.
And then put them on the path to success post-surgery.
Correct.
Dr. Kenney, thank you for being here.
Thank you so much for having me.
Very informative. After